These are the bones for the axial skeleton. The cranial bone consists of the frontal bone here, the parietal bones, the occipital bone, and the external occipital protuberance, which is where the muscles that keep the head upright and allow the head to tilt backwards are attached, and the temporal bones. The temporomandibular is this jaw joint area. The mastoid process is this one. The styloid process is underneath that. The external acoustic meatus is where the ear is. The squamous part is this front area, which is the forehead. Internally, we have the petrous part of the temporal bone, which houses the middle and internal ear cavities. The internal acoustic meatus is a small opening right here where the ear canal passes through. And this is the sphenoid bone. In the sphenoid bone, there is the superior orbital fissure, which the cranial nerves go through. And here is the lesser wing of the sphenoid bone, and this is the greater wing. The optic canal is where the optic nerves pass through. And here in the sella turcica is where the pituitary gland sits. The ethmoid bone is between the nasal bones and sphenoid bones, and the crista galli is the point that helps secure the brain in the cranial cavity. The cribriform plates are underneath, and they have tiny holes that let the olfactory nerves pass through. The frontal and parietal bones make up the coronal suture, and the two parietal bones make the sagittal suture. The occipital and parietal bones make the lambdoid suture. The temporal and parietal bones make the squamous suture. For the facial bones, there's the maxilla and the alveolar process here and here, the nasal bone, the zygomatic bone, which combined with the zygomatic process makes the zygomatic arch. The ethmoid bone is behind the nasal bone. The vomer bone is down here. And the vomer and ethmoid make the nasal septum. And for the mandible, which is this area here, this is the body, this is the angle. The mandibular condyle is up here, mandibular notch, and the coronoid process. So now onto the vertebral column. There's four curves. There's the cervical curve, the thoracic, the lumbar, and the sacral. The two primary are the thoracic and sacral, and secondary are cervical and lumbar. There are 7 cervical vertebrae. The first is the atlas, which articulates with the occipital condyles, and it allows us to nod our head yes. The transverse processes of all cervical vertebrae contain foramina, which allow vertebral arteries to pass through the transverse process to service the brain. There are 12 thoracic vertebrae. This is the spinous process, and on either side is the transverse process. The body is here, and the intervertebral discs are here. There are 5 lumbar vertebrae, and the sacrum is made of 5 fused vertebrae, and this is the coccyx. And for the sternum, there is the manubrium, the body, and the xiphoid process. And up here is the jugular notch. Lastly, for the ribs, there are 7 true ribs and 5 false ribs, with the bottom 2 being called floating ribs because they aren't attached to anything. Here's the head, the neck, and tubercle of the rib, and each rib articulates with the vertebrae because there's 2 facets that join onto that vertebra.